Before I introduce the speech, I want to introduce a very important person. John Belhumeur is a First Nations consultant with a doctorate, lots of business experience. He believes this is a really good idea, and one of our goals as a party is to reach out to many different people and get consultation going, and he's agreed to help us with this. So thanks very much for your time. We look forward to working with you on this file.
Thank you.
Do you have anything you want to say?
Well, I'm glad to see that the party is looking at working together with First Nations. Not only that, Burnaby is multicultural, right? And it seems the party really is reaching out to all the multicultural people, recognizing who they are, giving them the respect who they are. And the hospital is a great idea with elders care. Right there. Not only if somebody gets sick, the hospital is right there. It makes perfect sense. A brilliant idea.
Thank you very much. So as you heard, we're consulting. We have 9 more days before an election, but we've consulted for 7 months. This is not just a one-time thing. This party was built on consultation, transparency, outreach. So I got so many ideas here, but the beauty is this hospital is an election issue now. We're making it a priority. It's a wonderful day in Burnaby. This is good news for Burnaby residents. So I want to read you my remarks, and I'll take questions after. Mayor Corrigan and his council have had 12 and some 27 years for some of them to help our citizens secure a new updated hospital in Burnaby. Excellent health care is our most basic and fundamental priority at all levels of government in Canada. The current council has repeatedly failed to grasp and capitalize on opportunities to consult, cooperate, and collaborate with a wide range of prospective partners. The result has been many millions of dollars in foregone value for Burnaby taxpayers, and the hospital is front and center on this file. I and Burnaby First stand for a place of hope and healing that will support high-quality health care for our citizens, their children, and families for generations to come. This is truly an historic time in the city's governance as we campaign an election with the possibility for proactive and positive community change, such as new hospital investment. My goal is to be a steward with my group and the community to see construction of a new Burnaby Hospital building before 2017 with our First Nations brothers and sisters and the province as full partners. I can, with my team, develop those relationships with Burnaby First as your council. Construction costs of major hospital investment will only continue to rise. As you know, we're in the lowest period in our lives for interest rates right now. You remember a few years back on the Evergreen line, 20 years ago, it was about $200 million to build it, and now I believe we're talking about $2 billion, the same line. We understand that to see these major community investments take place, there are many governments, groups, and people to be included. Therefore, these projects take years to plan, let alone deliver. There is an opportunity now, with a 4-year term, that we could really accomplish something great for the city of Burnaby at this time. This type of proposed planning is entirely beyond the narrow scope of the current council's capabilities. They've proven that time and time again, and incorporates funding that has been available for many years, but for the mayor's confrontational politics. Planning and investing in a hospital takes passion, dedication, and efforts of hundreds of staff, physicians, patients, and families. Working with stakeholders such as the provincial government and First Nations is a required journey that must begin today. A journey to outline just what services will be in a modern hospital, the funding needed, and the hiring of the right people to help us design a state-of-the-art facility. We will make sure that patients, family, staff, physicians, the community at large, and elders are involved in this process. Today, we also want to thank all of those who have given so much and who continue to work tirelessly for us to deliver health services to our citizens. Health workers must be frustrated with our governments for not doing better for our people, yet they continue to do the best for us. So give me and Burnaby First a chance to represent you and our community to get the best modern health care into our community. Yes, it will take significant time and effort. We're getting calls already. Yes, it will mean hard work and many meetings with various levels of government, health authorities, First Nations, and community stakeholders, groups that we already work with. And we will partner with them and commit funds to begin the process. We must act now. Our major concern is for the health of our citizens that can no longer be delayed with banter about party politics. We all deserve the best medical attention that Canada can provide. Given the opportunity, I will work tirelessly with my group on this issue in addition to fulfilling my duties as a mayor in office. The time to act is now. Vote for change on November 15th. Vote for Burnaby First. Thank you for your time.